Hello, everyone. My name is Catherine Truesdale, and this team project is Team Up for Patient Experience. Everyone else, team members, would you like to introduce yourselves?
Sure. My name is Sandra Shirk.
Sylvia Benitez.
Hi, I'm Janice Walker.
And again, I'm Catherine Truesdale. This is Team Up for Patient Experience. As you know, guys, we're set here to go over a brief description of a patient experience. We will explain our case studies and why we feel our case study is a strong example of patient experience, and then we'll take questions and any challenges from other team members and come up together to assign what our text will be for the patient experience on the web page and answer the other additional criteria that's needed in the program. So I think we're going to go in the order of case studies first. So who has case study number 1 if they want to explain why their program is a strong example and take any questions, and we can get your, do your definition, your definition of a patient experience, and then explain why your program is a strong patient experience.
Okay, Sylvia has the case number one, and the patient definition for me is a group of patient experience leaders and is formed from across the section of healthcare organizations. And this group shares perspectives, insights, and backgrounds on what patient experience means to them, and the collaborate created this definition, and the sum of all interactions shaped by organizations, cultures, and that influence patients' perception across the continuum of care. And I have the Cape Coral Hospital notes, and I think my case is very strong because it is an example of a program that improves patient experience, that is that it finds the issues that needs improvement, which is to increase between patient and staff inside and outside the hospital, and uses a blog as a method to accomplish their goal of patient experience. And by using their voice through the blog, the staff and patients were able to start connection to improve the patient experience overall. And by creating a blog, it created a connection with patients and the hospital, and they were able to create a friendly atmosphere and decrease the tension and stress level of new and old patients.
Okay, sounds good. I like your everything that you said. I just had a little trouble just hearing the full definition. I apologize because I think at one point, like, you sounded higher and then you went lower. So I apologize. I was having just a little trouble hearing your definition of the patient experience.
Would you like me to say it again?
Yeah, could you? I'm sorry, because I was having a hard time and I caught some of it, but I wanted to make sure I could hear it all.
Okay, so the definition is a group of patient experience leaders, and is formed from across the section of healthcare organizations. And this group shares perspectives, insights, and backgrounds of what patients means to them, and collaboratively created this definition, the sum of all interactions shaped by organizations or culture that influences patients' perceptions, across the continuum of care.
And should I interject mine next, and then we can kind of like take all of ours, and then
you number 2.
Okay, yeah, I'm number 2, and I have as my brief definition of patient experience is interactions with patients and hospitals that will influence how the patient perceives how their care was. And that all can relate to the quality and the service and the processes of, each patient when they're in the hospital, either lab experience or inpatient hospital experience. And so that's my definition of the patient experience.
And I was number 3. So my definition of, and I'm sorry, and I meant to say both of you ladies, very good. I like what you guys said so far, very good. I'm sorry about that. My definition of patient experience is continuously building trust and confidence with each opportunity of delivery of care through communication, understanding, and treatment while improving health outcomes for all. So that was my definition. So I'm just basically saying that it's a constant movement. It's a constant process, building a trust in an environment such as the hospital, or like you said, wherever they are, in the physician's office, if they're in a lab area getting blood drawn. It's a constant, continuous building of the trust and confidence with each opportunity of delivery care, through communication, through talking to the patients, calming them, relaxing them, educating them, being sympathetic and empathetic for them, and continuously treating them to improve their health outcomes. And that was my patient experience.
Very good.
Very good. I guess I'm next. So I'm number 4. My definition is like all of you have said the same thing. I believe that the patient experience is from basically the time you start in going to the hospital or the clinic, even from that phone call, all the way to the time you leave the hospital, and how you've been treated at registration, from the triage nurse, the experience you get with her, or how they make you feel comfortable. All the way until you leave the clinic, the hospital. And like you ladies mentioned, very good example. So I think it's just that experience, that feeling, making you feel comfortable, like you're at home, and
right.
It's leaving you with a good feeling from the beginning to the end.
Right.
Great.
Agree.
So the key factors that contribute to a positive patient experience. What does anybody have to say about that?
I have that the key factors that contribute to a positive patient experience is awareness, behaviors, and delivery. I have awareness, and by awareness, I mean knowing and anticipating and addressing your patient's needs. So that's what I have as awareness. As far as behaviors again goes as creating the environment and the attitudes from all staff that we all spoke about, from all facets, whether it be the physicians, the technicians, anybody within the hospital. Behaviors, attitudes for all staffs, and to actively demonstrate and reassure patients that the patient is the main focus. So that's what I have. Behaviors are attitudes from all staff and physicians.
I like that the patient is the main focus.
Right, that the patient is the main focus. And then the other thing I have is delivery. Again, just providing care, coordinating the appropriate help at each level of care. And that's like what we all said, from the appointment level, if it's for coordination of care, getting referrals, if it's from prescriptions, educating, just the whole delivery. That's the key factors to me. So being aware, having your behaviors, and the delivery in which you provide is a key factor for patient experience. That's what I have.
I have, can I say what I have?
Yep, go ahead, Sylvia.
I have experiencing personal wholeness, which is like to ensure that all the patient's care and the support team are in the incorporated into person content care. And I also think that cultivating healing relationships is to provide compassion and empathy, because sometimes when you go to the hospital, staff, I guess, seems to be just doing part of their job, not having any empathy for you, like not understanding what exactly you're going through.
Mm-hmm.
Right.
I agree. I had that too. Compassion.
Good. Okay.
Okay, and I have, well, basically kind of just similar to what we've been saying, considering patients' care and needs, giving good service, quality service, and engaging and empowering the patients and their families in the care of that patient. So that's what I have.
Yeah, I also have mostly about the same. Also, smooth transition during the care. Show compassion, emotional connect with the patients.
Great.
So
Okay.
I think we agree compassion is definitely one.
One of them.
Right.
All seem to have that.
Compassion and considering the patient. I like what you said, Catherine, that, you know, the patient is the main focus.
Okay.
I think that is like excellent right there.
Okay.
Because that's what we need to always consider is our patients, you know, care is our main thing. So yeah, so we got good patient main focus, compassionate, caring, making sure everything goes smooth.
Right. So that was patient is the main focus, compassion. So was that coordination then? Or are we saying we're making everything go smooth?
Yeah, and so that we can give that good quality service. Yeah.
Okay.
Okay.
Mm-hmm.
All right. So next on our list is the HCAPS.
Yes. So, before we move on, I'm sorry. Let me just make sure. So is that 3 or 4 points that we have? Patient is the main focus, compassion, coordination.
And
Give good quality service.
yeah, good quality service. And we just want to always focus, to engage our patients and their families. They have more control in their care.
Right. Okay. Well, I guess that's it. Engaging.
Yeah. Engage. Yeah, exactly.
Or engaging. Engaging patient and family, right?
Yes.
Right.
That's
Yes. And care. Okay. All right. So that's the key factors. All right. Okay. So the next thing was what is HCAPS and how was it used?
Yep. This one should probably be pretty straightforward.
Right. So HCAPS. So of course, in HCAPS I have is the hospital consumer assessment. I basically said what it is. Hospital consumer assessment of healthcare providers and systems. And it's a survey used nationally to collect and compare data on the patient's experience while inpatient in the hospital. The survey basically has 27 questions, core questions. Each hospital can add additional questions, but the 27 questions are the foundation of the questions. And the hospitals take the information, use it in comparison with other hospitals to see how they're ranging. And it's basically used for an incentive for the hospital because based on how well they do, they get additional dollars for performing well.
Jake, give me a cord as soon as possible. My computer is going to die.
So
did we lose her?
I'm here.
No, yeah.
Oh, okay.
My computer is dying. Right down there, honey. In the other room.
So that's basically what I have for HCAPS is that they the hospital can use this incentive to yield a positive return for them. They basically can see how they can do, how well they can do, areas they can increase better in, get better service in, and then be rewarded additional money based on their performance and making people want to come there for care because they actually gain a reputation of being a hospital of providing well care. So it gets around. basically that they do a great job for the service.
Right.
Okay, and for
Yep, I agree.
HCAPS, I have similar thing, the definitions, survey and data collection that measures patients' perception of their hospital experience. We use this to compare with other hospitals to improve the quality of care and enhance accountability in healthcare. So it's a good measurement tool.
Cape Coral Hospital wanted to improve the connection with more people in the community. So when they created that blog, it was just to improve, I guess, or to get more inside and outside health system in engaging more people to come together. So by them doing this, it also improved the patient experience and overall experience and the person content environment.
So what did they do?
A blog. They created a blog.
A blog, and that was just
So
kind of everybody leaving their opinions, or?
Right. So to provide their patient experience, either positive or negative. So this is what helped, them come together in that to improve the service, I guess, because when you're giving your positive or negative feedback, it also encourages the staff to do better or improve.
Right. Okay, and then in my case, case number 2 was at the Cullman Regional Medical Center. And what they did was they decided to start like a recording of their discharge instructions. So when they did that, they allowed for less readmission to the hospital. And then the patients, a lot of times when they're discharged, they're not really listening to what the nurse is saying. They're kind of tired. They're not feeling good. They're overwhelmed. So they were able to then either use a landline, their mobile phone, a computer, or a tablet and get access, either using a code if they had their landline phone, or access on an app. And the nurse recorded the whole session so they could go back and listen to everything that she said, which in turn was very helpful. And that, of course, they got high marks from their patients, especially the elderly patients, in regards to being able to follow, their instructions and know what to do when they got home, because a lot of people, like I said, they forget. So,
oh, they're tired. They want to go home. So,
yeah, right. They're tired. They don't feel good. They're sick and tired. So, yeah. And then the nursing staff was, satisfied and happy with that too. So their patient experience and satisfaction went up, and the nurses were happy. Less admissions, like I had said, and actually, it said that the Joint Commission surveyor who came out there said it was a best practice policy. So that was good
cool.
too.
Yeah.
So yeah. So that was cool. That was a cool one.
My patient experience was third. That was Duke Raleigh Hospital. And the case study that they did at Duke Raleigh Hospital was they did bedside bar code scanning. So their improvement, their patient experience case study started actually while the patient was in the hospital during the course of treatment. With the scanning of the barcoding of the medications, what that did was it allowed for medication mistakes not to happen. Instead of wrong dosing or wrong medication being given at the wrong time, or medication that maybe was being used yesterday, but now they've changed to something different today, and it avoided mistakes. So first, initially, the nurses were hesitant about scanning, but once they began the scanning process, they caught on so quickly, and they vowed that they never wanted to do anything other than scan it, because not only did it allow for them to say, okay, that is the correct medication, it also then allowed them the opportunity to further educate the member and relax the member about the medication they were receiving, letting them know, telling them the side effects. So the first 3 side effects, or the top highest 3 side effects of the medication, would come up and they would discuss it. So they would say, now this medication I'm giving you could cause constipation. That's common. Just whatever the side effects were. And they were able to educate the member and let the member feel that they were a part of the experience, and also the decision process, what was happening, making them involved in the treatment that they were receiving. Not only in this experience did they deal with it at the inpatient level, they're now looking to expand it at the outpatient basis. So they've now incorporated the top 100 medications that they use at the hospital. They're now on this using the scanning system, and the side effects of those medications have come in. But they're also using it at the discharge. They're also using it at the discharge site as well. So they're teaching them about the medications when they're leaving the hospital, when they, they're outpatient.
Yeah, and that's huge because, patients don't know about their side effects,
right.
and they, they'll take their medicine, and then, sometimes they'll be on it a year and they'll say, oh my gosh, I didn't know that this was causing this. So that is huge.
Right. So they're now teaching them at the outpatient level, like, okay, you may have been on this medication while you were in the hospital, but now we've changed you to this, educating them about the side effects. So not only does it educate them while they're in the hospital, it also educates them at the discharge point, also giving them information about new medications and side effects and things like that, and show how patients are able to, avoid going back to the hospital, and how to take their medication appropriately. So I thought that this was a good example because it worked while they were in the hospital, and it reached them as they left the hospital as well.
Great.
Good point.
That is good. Yeah. Good. So do I go next?
Yep.
Yeah. Fourth case study.
Fourth study or case study is University of California, Irvine Healthcare. They wanted to do something different when it comes to treatment. When the patient gets admitted into the hospital, they want to take a different route to take care and provide a experience. Basically, what they wanted to is transition to a work to the relation-based care, kind of like a case management type of thing. So what they started, it was probably a challenge to create this, because when their patients were going into the hospital, they were just getting, one day see one nurse, the next day the other, and so on. So they didn't get that comfy feeling with the nurses.
Right. It wasn't, that continuity of care, right?
Yes, exactly. So they thought, well, maybe we need to do something different, and that's when they came with a team who actually discussed about having a primary nurse, kind of like a case manager, that will be from the beginning to the end through the whole treatment. It was the oncology department, so that's probably one of the biggest things too, that you want to be able to get to know the patients better than just, today I see Nurse Jane, tomorrow I see Nurse Mary. So
that's very important, especially for cancer patients,
right,
to see that familiar face. Yeah.
Exactly. So they actually created that. And from what I've actually researched on this study was that they, in 2006, the oncology unit ranked 58th percentile at 72. By 2010, the unit moved from 87 percentile with a top box of 81%. So that was a big improvement.
Mm-hmm.
Relationships between patients and nurses improved, and also they saw the nurses, their communication and confidence among nurses improve as well. So that was
Very
my
good.
study. Thank you.
I think all patient case studies were very good.
I think so too.
I have to be honest. I like the fact that the two, Janice's and Sandra's, you guys have measurable improvements noted in yours. Like mine, they talked about how they did it and how they did it while they were in the hospital and they were looking to move it to a next level program.
Right.
I like how Sylvia's blog talked about how they brought the community together and how they wanted to make the improvements. But I like how your two actually had measurable improvements. So I eliminate myself as being the best. I withdraw mine because I don't have any measures. Like you guys came up with numbers, so the numbers don't lie. So I say my vote is okay. Let's look at YouTube and let's decide the best from there, and go from there. Anybody else? Everybody else has their options.
Okay. So which so we've got what, option 2 and option 4 that we're liking. And I agree. I like mine and I like Janice's. And what about you, Sylvia?
I want to be last because I know it's tough. I like the recording discharge instructions, to be honest with you, but I also agree with Catherine, what she said about the other one, Janice's. So I will go with Janice's, I guess. No, let's go recording. I'll do recording. I'll go recording the discharge instructions. Sorry.
Okay.
I'm sorry.
So, okay, so recording. All right. So what about, so then what do we think? Well, should we do case study 2 then?
Sounds good. I'm good with case study 2.
Okay. So then,
I'm good with more.
Case study 2. Okay. So then I guess then I will do the writing on that.
Okay.
That makes sense, right?
Right.
That makes sense.
Before we get ahead though, did we ever discuss what areas of the patient experience are hard to measure?
No, we did not do that.
Okay, so now that we went through our case studies, this is probably a good one. What do we have for that? Anybody want to go first?
I have a little something.
Go ahead.
I got a little something. To me, it's hard to, basically with communication, people communicate and we all transmit our agendas in a different ways. But in order to measure the specific results, understand the total answers thing, because I could go in and say, oh, my nurse treated me bad, but the doctor treated me really good. So how do you measure that? It's just an overall experience.
Just like,
so to me,
yeah, you're right. Just like the food, like somebody might say, oh my God, the food was awful. But yet somebody who hasn't maybe had a decent meal in a while, it's, you know what I mean? Is not going to be like, oh, that was great, you know, because I haven't had nothing to eat, you know, hardly, or I eat crackers or I eat peanut butter and jelly every day.
Right.
Yes.
So it's all in, I guess, the patient's perception. Is that what we think then? You know, if it's great or good, it's all in how the patient perceives it and how they're then going to be satisfied with the service. So, yeah. That's kind of what
Yeah, because I was with like Janice, like I thought that it was in the communication. It's hard to measure what areas it was like communicating, because like you said, if I don't have a full understanding of what your need is, then how can I make sure I'm addressing your need? The other thing was just like how they talked about suffering, the different levels of suffering. If I don't know what's causing your suffering, or if I'm not paying attention that it's either your disease or if it's from the treatment of it that's causing suffering. So to me, it's like communicating, understanding exactly what the what it is, and to me, That's
And that's hard. Yeah, and that's hard if you've never gone through a cancer treatment or you haven't had severe pain. Yeah, it is hard when you're suffering.
Mm-hmm.
I agree with you. I especially like the old people, you know, like the seniors, like having the recording instructions is rarely really helpful because like they go home and they don't remember anything what you have said, you know,
Right.
because they're more like perceptive when it comes to.
So they're like you say, like they're ready to go home. They've been in the hospital. You know, so sometimes they're frustrated or they can't understand what's being said. So you're right. Like the recording is a good idea, definitely for elderly patients to look back and be able to hear again or to re-emphasize what was already said. So
Yes.
I think that so is that it? We are in agreement that it's communication. We think that one of the areas what areas of patient experience is hard to measure.
It's hard to measure communication, yeah.
Mm-hmm.
And
and okay, and I would say communication, and let's say it says,
and the whole patient experience, like how do you can't measure it because of how, you know, we all think differently, right. We all feel differently, you know, so yeah.
Okay.
Okay, so now we need to
decide.
We're going to complete our portion, and so far I'm the only one that has a portion.
And so we say a definition of patient experience and the key factors that contribute to a positive patient experience. So I have the key factors written down that they were patient is the main focus, compassion, coordination, and engaging patients and family and care. I had that as the key factors. Definition of a patient experience.
I say that the definition will probably be good patient experiences when patient is having the first contact with the patient. When we're having, I guess, the patient first contact with the patient, and when the patient feels welcome, the interaction by the telephone or in person, and to make the patient feel like they are at home or make them feel safe, I guess is just saying what Janice already had said, that they don't remember what you said or what you did to them. They're just going to remember the negative, I guess.
So all the notes that we took on that, who feels the most comfortable writing that portion of the webpage?
I'll do it.
Okay.
I'll
so
do
Catherine,
key factors and the patient experience goes together. So I'll put it together based off of
all our notes and our yeah. Okay, and then we have the HCAPS and how it's used, and who would like to tackle that one?
I could probably do the HCAPS.
Okay.
Okay, so that's Sylvia. And then, Janice, you're okay with giving the patient experience, what was hard to measure about the whole communication? Yeah, you said something really good about that too. So I think that, and then what we all added, of course, we're all contributing.
Mm-hmm. Sounds good. And
then we're supposed to like include our citations then of all anything that we used.
Right.
And it's supposed to be a paragraph, correct? Like a paragraph on each of these steps.
Right.
Okay. So then are we to email you, Catherine?
Yeah.
The paragraphs with our citations?
Yeah. So I think that we probably will. Yeah, let's do that. Email it with the
by the 16th.
So let's have everything by 15th so that we can get it in, make any revisions we need to submit it by the 16th.
Okay. So are we all in agreement?
Yes, if you want to go, that's our drop dead date, the 16th. So let's get everything in by the 15th, review, look it over, collaborate, give it the final aha, and then we send it by the 16th.
Okay, so we got to include the citations and then the paragraph.
Right. So, Sylvia, your what HCAPS is and how it was used. So you're going to do your paragraph for that, your 1 to 2 paragraphs for that, and whatever citation you used to come up with your 1 to 2 paragraphs for that.
Okay.
Mm-hmm.
Okay.
Okay.
So then we'll get our paragraphs, we'll get our citations, we'll email, and then what? Are you going to send out an email with the completed project, or how do we want to do that?
Exactly. So when everything is together and in, then I'll send it, then we can all look at it and review it and see whatever corrections we think need to be made. If something is wrong, citing, whatever, we can make those corrections and then send it
We can
in.
submit it.
Mm-hmm.
Yay.
Mm-hmm. Okay.
Sounds like a plan.
Okay, so I'm going to stop the broadcasting, but we'll still be on 1 second.
Okay.